It is the most abundant of plasma proteins. It is synthesized in the liver as preproalbumin and released into the blood as albumin. Its half-life is 20 days and its molecular weight is small. It decreases rapidly in cases such as liver damage, infection, and surgical interventions. It is used to evaluate liver functions and nutritional status. It is used clinically in the treatment of burns, bleeding, and shock. When liver damage occurs, liver cells cannot function to deliver sufficient albumin to the plasma. The purpose of albumin is to maintain oncotic pressure against hydrostatic pressure. It is used to keep the fluid in the blood and stabilize the blood volume by giving albumin to these patients due to rapid extravasation of fluid in burns, bleeding, shock. Three main causes of hypoalbuminemia are decreased synthesis, abnormal distribution or dilution, and abnormal excretion or destruction. Decreased synthesis is due to malnutrition or malabsorption or in advanced liver diseases. Abnormal distribution or dilution is caused by overhydration or conditions where capillary permeability increases, such as sepsis. Abnormal excretion or destruction caused by nephritic syndrome, protein-losing enteropathies, burns, bleeding, catabolic states. Normally, albumin is reabsorbed from the kidneys. If kidney functions are impaired, protein loss occurs and albumin may be excreted from the kidney. Hypoalbuminemia causes edema, decrease in the transport of various molecules such as drugs in the blood, and total plasma calcium level decreases, but ionized calcium remains normal. There is no clinical condition that increases albumin synthesis in the liver. The only cause of hyperalbuminemia is dehydration. Prealbumin carries thyroid hormones and complexes with retinol-binding protein. It is also called prealbumin because it migrates faster than albumin in electrophoresis. Its half-life is short, 2 days. It may also be loosely bound to the structures carried by the albumin. It is a test used in the clinic to diagnose protein malnutrition. Blood levels decrease in liver diseases, nephrotic syndrome, acute phase inflammatory response, and malnutrition. It makes up 90% of the alpha-1 band. Synthesized by the liver and macrophages. It is one of the acute phase proteins and generally an inhibitor of all serine proteases, plasmin, thrombin, trypsin, chymotrypsin, elastase, etc. It is responsible for 95% of the antiprotease activity in plasma. Proteases can be produced intracellularly, by leukocytes or by bacteria. In case of infection, protease is released from bacteria and leukocytes. Alpha-1 antitrypsin is an antiprotease. It is used to restrict and limit these proteases released by leukocytes in case of infection. It also inhibits digestive enzymes. Their levels increase in case of infection. Alpha-1 antitrypsin deficiency may be due to genetic reasons or may be caused by smoking. Alpha-1 antitrypsin deficiency causes emphysema in the lung. Ceruloplasmin is synthesized in the liver. It carries copper. A large proportion of copper is found in the blood bound to ceruloplasmin. It is an oxidoreductase enzyme and prevents tissue damage in the acute phase response. Also known as ferroxidase, it helps bind iron to transferrin, catalyzes the oxidation of ferrous iron to ferric iron. The molecule that carries iron is transferrin. It carries iron in +3 form. It is ceruloplasmin that converts iron to +3 form. Ceruloplasmin both carries copper and controls iron metabolism. It also controls the absorption of iron in the intestines. Wilson's disease occurs in copper metabolism disorders and copper accumulates in the body. The protein that binds free hemoglobin is haptoglobin. It is hemopexin that binds free heme. It is alpha-2 globulin. It is synthesized in the liver. It restricts iron loss by preventing hemoglobin loss from the kidneys. In hemolysis, free haptoglobin levels in plasma decrease, so it is a test used to monitor intravascular hemolytic anemia. Immunoglobulins are proteins that work as antibodies in the body's immune system. It is synthesized by specialized B lymphocytes originating from the bone marrow. It consists of light and heavy chain parts. It is the largest protein in plasma after immunoglobulins. It has anti-protease activity. It is also a protein with a transport function. 10% of plasma zinc is transported with alpha-2 macroglobulin and the rest with albumin. It is the main iron carrier protein in plasma. It protects the body from the toxic effects of free iron by binding iron. C-reactive protein, CRP, is one of the leading acute phase proteins. It is synthesized in the liver. It is one of the most sensitive acute phase proteins. It is important in phagocytosis and activates complement. Plasma levels increase in inflammatory events and are used to monitor the course of the disease. Highly sensitive C-reactive protein is used to monitor cardiac events. The system that reacts against the tissue during tissue transfer is human leukocyte antigens. Human leukocyte antigens are a part of lymphocytes and are involved in recognizing foreign structures. Beta-2 microglobulin is also a part of this structure. It is a very small protein. It is found in most lymphocytes and cells with nuclei. Due to its small size, it can be filtered through the glomerulus and greater than 99% is reabsorbed. Therefore, it is an indicator of renal tubular function. It is a tumor marker in monitoring B-cell tumors and cancers such as leukemia, lymphoma, and multiple myeloma. If plasma proteins increase during inflammation, it is called positive acute phase protein. If it decreases, it is called negative acute phase protein. Negative acute phase proteins are albumin, transferrin, transthyretin, transcortin, and retinol binding protein. Positive acute phase proteins are CRP, D-dimer protein, alpha-1 antitrypsin, alpha-2 macroglobulin, fibrinogen, prothrombin, factor VIII, von Willebrand factor, plasminogen, complement factors, ferritin, ceruloplasmin, and haptoglobin.